Hi, this is Dr. Tremblay from Northland Plastic Surgery. Am I going to lose weight from liposuction? That's one of the most commonly asked questions we have here in Duluth about the procedure, and the short answer is really important. It's no. It's a body contouring procedure that's meant to refine. It's meant to target specific areas that are stubborn on your body. It's not meant as a whole body weight loss procedure. We use it on pockets that are resistant, such as your love handles, potentially under the neck. Some folks like it on the thighs and even on the arms, and the abdomen, of course. Who's the ideal candidate for liposuction? It's someone who has already reached or is very near their ideal body weight. Liposuction is a refining step, not a starting point. Now, if you're using GLP medications and you've stabilized, that's often a good next step. So there are three things lipo is not good at, and the first one would be significant weight loss. The second one would be cellulite. Cellulite is a structural problem and liposuction won't address that. And also loose skin. You'd need a separate procedure to address any loose skin. When patients come in with realistic expectations, they're the ones who consistently say they love their results. It's about refining what's there, not transforming who you are. If you're curious about if lipo would fit your goals, please call to schedule with us here at Northland Plastic Surgery. We'd love to hear from you.